Alright, sorry, I was about arranging this before we continue. Okay, so we'll talk about Helicobacter pylori gastritis. Helicobacter pylori gastritis. So it's just way so simple. Gastritis is inflammation of the stomach. Helicobacter pylori is actually a bacteria there. So it just simply has to do with there was an inflammation of the stomach, and what caused it was the Helicobacter pylori bacteria. Okay, so we say that it's a stomach infection caused by the bacteria known as Helicobacter pylori. So because there's infection usually leads to inflammation of the stomach lining, and there's ulcers, and of course if you leave it to keep progressing, there's a risk of it actually becoming stomach cancer. So what is Helicobacter pylori gastritis? It's an inflammation of the stomach lining due to bacterial infection. So more than half of the world's population may carry this Helicobacter pylori, but probably is not causing issues to you because your body is arranged and all of that. Do you understand? But if it keeps going on without any checks and balance, might actually result into a problem. Do you understand? So it's usually spread through saliva, through vomiting, through stool, through contaminated food and water. Okay, so symptoms: most people don't show symptoms, but when they do, common symptoms include burning or gnawing stomach pain, nausea and vomiting, loss of appetite, bloating of the abdomen. They could result into ulcers, result into bleeding, and you are losing so much blood, resulting into what? Anemia. So diagnosis is breath test, that's urea breath test, stool antigen test, blood test, then endoscopy. So you treat it because you are dealing with bacteria. You basically use what? Antibiotic treatments. Okay, so antibiotic treatments are some things you use there. Okay, proton pump inhibitors to reduce the amount of acid that is being formed. Okay, then sometimes bismuth compounds are added. Okay, so treatment usually lasts 10 to 14 days.